Dr. Verma, thank you so much for meeting with me to help explain for our community about Lewy Body Dementia. So October is Lewy Body Awareness Month. Can you tell me a little bit about how Lewy body is different from Alzheimer's disease?
Absolutely. So Lewy body disease is when individuals have different kinds of problems than Alzheimer's disease. So most commonly, Alzheimer's disease manifests itself as memory problems, repeating questions and conversations. As opposed to Alzheimer's disease, in Lewy body, what we see more frequently is that people have planning difficulty, multitasking is harder, anything that involves multiple steps is harder. In addition to that, we also notice that individuals will have problems with visuospatial issues. So navigation is harder, in what cabinet, what kinds of kitchen items goes, that kind of issues are more common in individuals with Lewy body. And kind of speaking at a more deeper level, the kinds of proteins that cause Alzheimer's disease are called as amyloid and tau, which is very different from Lewy body proteins, which is called as alpha-synuclein.
So are there some strange features that point you in the direction of Lewy body whenever you're seeing a patient?
Absolutely. There are some strange features that I would want the families and patients to know about, which includes acting out in dreams. So usually when we all dream, our body should be paralyzed. But in individuals who are likely to develop Lewy body disease, when they are dreaming, their bodies are not paralyzed, so they end up kicking and punching, even screaming, jumping out of bed. So if this is something that you notice with your loved ones, we definitely recommend having evaluated for Parkinson's disease or Lewy body disease.
Okay. So it's really important to us at the Alzheimer's Alliance, and I know to you as well, that patients and families advocate for themselves. So I would say, what would you like to tell families if they're having a hard time getting a diagnosis and they don't feel like Alzheimer's or another kind of dementia really fits? How would you recommend that they advocate for themselves?
So the first step would be educating themselves in terms of what are the symptoms of Alzheimer's and what are the symptoms of Lewy body. And if they feel that they are not meeting the criteria for Alzheimer's disease, then taking out time to write down what symptoms they are noticing, and if they are fitting the picture of Lewy body, trying to bring it up with your primary care or neurologist. And if you have a behavioral neurologist or a dementia specialist in your area, that can help. And these features, as we talked about, was acting out in dreams, having visual hallucinations, seeing things that are not there. Sometimes it can be as subtle as seeing a shadow pass. Yes, and that's something that we might think is normal, but seeing shadows move in your peripheral vision is also a sign of Lewy body. Having stiffness in your body where you have muscle cramping and stiffness, and having big changes in your attention levels on a day-to-day basis, where almost as if someone flipped the switch and you were very attentive and talking to someone and suddenly you glaze over and you cannot talk. So those kinds of symptoms are Lewy body symptoms. So we want our friends and families to know about these symptoms and keep an eye out for them.
Okay. So that's something that's really different from Alzheimer's disease. So primarily the difference is with Alzheimer's disease, your first presenting symptom is going to be that short-term memory loss. But that might not be the case with Lewy body, is that right?
Yes, and many times it's not even the cognitive or memory symptoms. Many of our family members will present with sleep symptoms like acting out in dreams, or they will present with these hallucinations, seeing shadows. And because they're so unusual and something that we don't connect with the word dementia, families might not even pick up these symptoms as a symptom of dementia. So that's why awareness about this condition is the first step to be able to advocate for yourself.
Wonderful. Well, thank you so much for your time and helping explain to the community about what Lewy body dementia is. And thank you all for watching. And if you have any questions or if you feel like you are concerned about your loved one's cognition, you can reach out to us at the Alzheimer's Alliance or Dr. Verma at the UT Tyler Dementia Center.